Welcome back. It is Thursday, so it's time for Talking Kids with Dr. Caitlynn.
Yes.
Dr. Caitlynn Iddings, will you let me finish?
I'm so sorry.
Is with us this morning, as always.
Yes, she is a Lexington pediatrician, and today we're talking about Congenital Heart Disease Awareness Week. So, Dr. Caitlynn, great to see you as always.
Yeah, good morning.
Okay, so it is the Awareness Week right now.
Yes, the 7th through the 14th.
Okay.
Which ends on Valentine's Day, you know, heart,
Yeah,
like that's
yes.
right. Makes sense, sure.
Yeah.
Okay, so what is congenital heart disease?
Yeah, so congenital heart disease is any sort of either structural defect of the heart, so that can include, you know, the muscle structure, that can include the heart vessels, that can include, you know, anything in the heart that basically did not form properly in utero.
Okay.
And so these can be, they can range from very mild, where it's just like a small hole in the heart that may close on its own over time, to very drastic, which would be something like hypertrophic left heart syndrome, where essentially you don't have like a right side of the heart to pump the blood through. And you know, it's actually more common than most people realize. So 1% of all children born will have a congenital heart defect, and so that's 1 in 100. And so when you put it in that sort of
Oh, wow,
timeframe,
yeah.
like, you know, and that's 40,000 babies every year. And so I think that a lot of people aren't aware actually how common it is. There's about 2 million people in the United States living with congenital heart disease currently, and over half of those are adults now. So the other thing that's good is it has become much more survivable. You know, when 20 years ago, 30 years ago, the survival rate into adulthood was much less, and now we're kind of broaching up to, you know, 90, 85% will survive into adulthood. So.
And what is the reason for that? Just better treatment,
technology,
better
surgeries, better detection. So the big important part of this is trying to detect it when the baby is still inside the mom, so that you can make sure that they're at the appropriate center to get that immediate attention that they may need. However, you know, the very severe ones are usually detected on ultrasound, but most of the more minor ones, only about 15% of women will report that they had that diagnosis before the baby was born. So a lot of those aren't found until day 3 of life, all the way until the baby's over a couple weeks old.
And then it's about monitoring and making sure that things are progressing the way you'd want them to.
Yes.
And always check in with your pediatrician. If they're going to participate later in life in athletics, always make sure they get a physical, that kind of thing.
Yeah, yeah. And so actually my oldest daughter has a VSD, and it's, like I said, that's one, it's a hole in the heart between, or the wall chambers there. And I didn't know it until she was about a week old, and the doctor heard a murmur, and I was like, oh, you know, I was just like third-year medicine student, just knew enough to be dangerous, and so it can be really like alarming when you hear those things. But knowing that, you know, there are now really good treatments out there for that. She didn't end up having to have surgery. About 1 out of every 4 of those congenital heart lesions will end up being what we call critical. So about 25% will need surgery in the first year of life. So it is very important when they're little like that to continuously follow up, make sure, like you said, are the pressures okay? Is there anything that we need to act on earlier? Nutrition is really important, because a lot of those babies, you know, warning signs would be they have a hard time feeding, they get really short of breath, they breathe really fast. A lot of them are a lot more sleepy in that first amount of time, where it's like, oh, I thought they were just sleeping because they were well fed. Well, actually they just don't have the energy to be more awake and move and eat. And so those can be warning signs. If you're like, oh, my baby's tired excessively, they have a really hard time taking their bottle compared to, you know, my other children. And honestly, the other thing, the big area that we need to focus on is just more research on causes, because 85% will not have a known cause for why it happened. You know, there are some things that are more genetic, that are part of a syndrome, but 85% of moms will never know like why this happened, and it wasn't anything that they did. You know, I think that a lot of moms have that guilt of like, oh, this was something that I did during the pregnancy, and it's like, no, we don't, it's just dumb luck. We don't know why. I'm sure there are probably other genetic markers, and more research in that area needs to be done.
Yeah, absolutely.
Well, again, Congenital Heart Disease Awareness Week. Dr. Caitlynn, thank you for coming in. We appreciate it. Good to see you as always.
All right, stay with us. You're watching Good Morning Kentucky. We're back right after this.